Hello, friends. You are aware about the importance of conversations. When you listen and converse, you are able to understand different perspectives. Gunwati Jagannath Kapoor Foundation has been working in cancer care for more than 10 years. During these years, we have guided more than 4 lakh patients and we have understood the importance of closing the cancer care gap. This brings us to today's conversation with none other than renowned oncologist Dr. Shripad Banavali of Tata Memorial Centre. I request you all to watch the entire video and please leave your comments. Also, request you to like, share and subscribe our channel. Hello, Dr. Banavali. It's a pleasure to have you with us today.
Thank you.
To begin with, as you are aware, World Cancer Day was established 23 years ago on February 4th in Paris. So, with your expertise, what do you think this day represents and how has it changed and evolved?
Over the years, many of the non-communicable diseases have taken an upper hand with the control of communicable diseases, infectious diseases with vaccines and all. There's more importance now of the non-communicable diseases, and these are again what we call lifestyle diseases. And as you know, heart disease, heart elements, diabetes, cancer, these are three of the commonest NCDs, what we call. And cancer is one such disease where people do not want to talk about. And the C word is such a word that people like to stay away from it. But days like the World Cancer Day has given us an opportunity to talk about this subject and most importantly create an awareness of cancer. And with awareness, basically people, there are many myths on this subject which can be dispelled if you talk about it. So I think World Cancer Day has given us an opportunity to create more awareness and for people to accept that cancer has now become an important disease which has to be talked about if we have to control the so called cancer epidemic or pandemic which may come, which is around the corner now.
Yeah, that's very true. I think, like you mentioned, it has provided us with a platform to talk and discuss things. As you are also aware that the theme around World Cancer Day for this year is Close the Cancer Care Gap. And India, as a developing country, has been trying to do its best to overcome our healthcare structure. So, what do you think are the major gaps still currently in India, and how do you think we can kind of do something to minimize those cancer care gaps?
Very important question because still there are plenty of gaps there. We have nowhere come near closing the gaps because first of all now slowly the cities are accepting cancer as a disease. Even now when we talk, we see patients in the clinic, there are parents, relatives who from behind wave their hands and tell us not to talk to the patient about cancer. We do not discuss even now openly about cancer with our patients because of logistic reasons, because of various taboos which are there still in this thing. So there are many gaps even in the society. To close the cancer gap between the cities and the rural India, as you know, there's a huge gap in that. There are still plenty of things which need to be done. And very importantly, I think we have to first accept that cancer is a disease which is curable, which is treatable now. I won't say curable in all aspects, but very rightly so it's treatable. And very, very importantly, 70% of cancers in India are totally preventable because that's the more important thing. Cure, treatment comes secondary. Treatment usually costs much more than prevention. So I think cancers like oral cancer, which India is the world capital, cervical cancers, which again India is a world capital, breast cancer incidence is increasing like anything. All these are cancers which can be highly prevented if we take proper steps. And I think this opportunity to create the awareness, create the atmosphere of trying to prevent the cancer from happening, this gives us an important opportunity to do that. And I think that's the first gap that we have to shorten, that we, in a country like India and many of the other low and middle income countries, we should not be talking more about treating cancers, but we should be talking more on preventing cancers. And India, luckily, 70% of our, 60% of our cancers are preventable. And if we do that, the incidence of cancer would come down tremendously.
So, sir, like you rightly said, awareness is very important. And you know, it's one of the key controls for us in cancer. So, what do you think we can turn awareness, how do you turn awareness into action actually?
Yeah, very importantly, again we have to pick up the right population to cause awareness. And when we think about cancer awareness, we turn to people in the community who are smoking, who are chewing tobacco, who are drinking alcohol. That's important, but that's too late. If we have to create awareness, we have to go to these schools in this thing, and even the primary schools, not in secondary, because we have seen many, in many places in rural India, students start eating tobacco when they're in 7th and 8th standard. So that's too late to create the awareness. So ideally, we should be visiting primary schools in all over India. Why only cities, but also in rural India, and start talking about, and it should be multitasking. When we go, if I'm a cancer specialist, I should not be talking just about cancer, but we should be talking them about all the non-communicable diseases, because all of them go together. And all of these are what we call lifestyle related diseases, whether it's heart element, whether it is diabetes, whether it is cancer, all these are interrelated, and one of the most important thing is the lifestyle.
Very true. I think you've hit the nail on the head, and I think the viewers are really going to be very happy with some of the things which you have said in terms of lifestyle changes, which we have to do at an early age. Keeping these things in mind, as you know, there are a lot of stakeholders in the healthcare systems. NGOs is one part of the healthcare system. How do you think NGOs can help do this closing of the care gap with cancer?
When you talk, I work at the Tata Memorial Hospital and Tata Memorial Centre, which is situated in Mumbai. And as you know, we see nearly 60 to 80,000 new patients every year. Now, why do these patients come to Tata? One is that Tata has made a name over the years. But the second thing is, it's not that they know the doctors or the individual doctors and they come for the doctors. Why they come to Tata is that they know that once they come to Mumbai, once they come to Tata, they will be taken care of. And why we can take care of this many numbers is not because our staff is huge. We all government hospitals everywhere we work with limited number of people. But the reason why we can take care of this many patients is because there are a lot of NGOs who work with us and help us take care of these patients. Main thing that the NGOs has to do now is stop concentrating only on cities. We should do. I mean, patients here still need a lot of help. So if, for example, you have one thing in cities, we should have another 2 or 3 branches or support system in the rural area also. If you are collecting 100 rupees for cities, if you collect 100 rupees, out of that at least 20 rupees should be kept for rural.
So, like the thing is, we need awareness, we need access to care at the doorstep, and we need things to be done differently at the urban as well as the rural areas. I think that will change the close the gaps for cancer care, especially in India. That being said, there's a lot of emphasis nowadays on not just the treatment of cancer, but also on the psychosocial aspects of cancer. And our foundation is one which kind of focuses more on this. Would you have any kind of suggestions or feedback on how we can help further close this gap?
Very important, because I told in the beginning all these diseases are lifestyle diseases. But when we talk about lifestyle, we only talk about basically the diet, the exercises, the basically avoiding all these alcohol and tobacco and all. But the other important aspect of basically the lifestyle is basically taking care of. We are talking all this about taking care of our body. But along with the body, we have to take care of our souls also, and the mind. Soul means what? It's the mind. We always tell that disease, all these are stress-related diseases. Stress was not there some years back. Why now stress? Why now there is so much increase in cancer? Why there is so much increase in hypertension, diabetes? So I think, yeah, it is very important. Psychosocial aspect of everything is important, because just giving good diet will not help. Just telling your patient to exercise is not going to help.
True, true. Sir, as you know that TMH, like you mentioned already, sees a lot of footfall in terms of patients. Um, dealing with such a huge amount of patients definitely takes a toll on all the people, the doctors, the nurses, all the healthcare workers. How do you think these people do it? Like, what's the motivation?
Yeah, first, like I told you, it's not only the hospital or the administration takes care of the patient. There's a lot of support from NGOs, from volunteers who have helped us over the years and keep on helping. And because of all that, we have been able to take care of the patient. And recently, as you know, since last few years, we have started a very, very important new course in the curriculum of oncological care, onco care, is the Kevats. Kevat, as you know, in Mahabharata, in Ramayana, was basically a person who takes Lord Rama from one coast to the other, and he helps him to cross the river. So same way here, these Kevats actually they help the patient navigate. It's basically Kevats are patient navigators.
No, that's excellent. I think guidance coordinators and navigators are very important.
Very important.
And they can, like we discussed before, psychosocial behavior, and you can help with a lot of things at the initial stages for cancer patients. So I think
That
that would
reminds
be a
that
great addition.
yeah, that reminds me another thing we do in Tata, and we started it with pediatrics, but now done across other what we call disease management groups, DMGs that we have is, see a doctor can give 5 minutes, 10 minutes to a patient, but the 80-90% of the questions that patients have are same. So it is about diet, it is about sleep, it is about pain. So what we have been doing over the years is we have patient support meetings. So we have auditorium. In the auditorium, for example, all the parents of pediatric patients, they come together, and then we have a doctor, social worker, multiple people who come there, and then they first talk about the disease and all, but after some time we have question answer session. So this whole thing goes on for 1.5 hour, and instead of getting 5 minutes of the doctor, they're getting 1.5 of the hour of the doctor, and that answers 90% of the questions. So places we have to innovate. We cannot be what the was done in the US, where they have 100 doctors for 100 patients, and where we have here one doctor for how many patients. So we have innovated this, and it's working very well. Not only with the pediatric, but the thoracic disease group does it, breast cancer people. So all the disease management groups now have this what we call patient support meetings.
No, this has been really an interesting conversation, and I think the viewers have learned a lot about some of the gaps, some of the interesting things which India is trying to do, like the psychosocial model, the guidance models, the coordinators, as well as, like you said, access at the doorstep, which is very important, and focusing on awareness and prevention along with at the educational level, with the school level. I think that could be one of the game changers for India specifically to close the cancer care gap.
So to add to this, I forgot one aspect. We talked about all the others, the NGOs and all, but the main part of the treatment is the cancer doctors.
Yes.
So that's another thing that we have been doing at Tata. Many of us are going once a month, once in this thing to rural areas, to areas where I think that's another aspect which there are so many tertiary cancer centers across the country. Most of them are in cities. So even if 10% of the doctors working in these tertiary centers go and adopt one or two centers, it's not that we used to go initially also to give lecture every month. We have gone, every week we have gone and given lectures. That doesn't help. But the same doctors go and adopt one or two rural places, where there is no cancer care, and start developing that. That is also as important as the NGOs going, or as
Right.
so we can't be biased that only NGOs should go to rural. Doctors should also, I think, go to rural.
With that, I think Dr. Banavali, what would you like to leave the viewers with? Any message for them?
Yeah, message means, again, the cancer is not, it's not something that has to be afraid of. It's like any of the other diseases, but it has to be faced along with, doctors cannot treat cancer alone. The patient also has to be part of the treatment, and together with the support of the NGOs, with the CSR support and the societal support, if we do that, we will be able to take care or tackle this pandemic of this thing, because it's going to increase. Already the numbers are increasing mainly because our ages are increasing, diagnostic facilities are increasing, so all throughout the numbers, but overall the number of cancer cases are increasing, and we cannot tackle this alone. The whole society has to come together to tackle this problem, and I think we will do that and give lot of stress on prevention rather than treatment. Thank you.
Yeah, thank you so much, Dr. Banavali. It was a pleasure having you with us, and I hope the viewers can enjoy the conversation and take away the message, which is awareness, prevention, access in the rural areas,
And service.
and service, which is the most important. Thank you.